People, don't really appreciate the fact that our body responds to many, many things all at once. And so the direct correlation between just one action and another is not always necessarily there. For me as a consumer to wrap my head around that and really get to the point that I'm really doing data analysis is hard. And so guess what? I don't do it for the most part. So even though the numbers became more available, that in and of itself didn't necessarily change the outcome.
New choices, new players, new models of care. Consumer-first healthcare is everywhere. For us to build the future, to see what's new, we gotta look at the world from a different point of view. Consumer innovation ain't going away. I say it's here to stay. Today it leads the way. We gotta drop the silos. We're all the same team. Experience, business, tech, and marketing. So join us now. Join the revolution. Consumer-first health is the evolution. Status quo or like status no. Yeah, this is the healthcare rap. Yo, come on, let's go.
Welcome back to the leading podcast about consumer-centered healthcare. What if healthcare was actually centered around what consumers need and expect? We're talking with leaders who are making it happen one experience at a time. I'm Jared Johnson, and this is episode 396. Today, we have the Flava of the Week about Lifetime offering DexCom continuous glucose monitors. Yeah, you heard that right. How will the partnership engage health-conscious consumers, and can the combo of fitness and digital health reduce the need for healthcare services in the first place? I'll talk about that. Then we welcome Oren Nissim, CEO and co-founder of Brook Health, to discuss the current state of home health, understanding how a consumer thinks about their chronic condition on a daily basis, and how to break down silos between RPM and care management. It's time for the awesomeness, y'all. Are you ready? Let's go.
Flava of the Week.
In case we haven't pointed it out enough lately, connected fitness is on the rise, and a new partnership is giving us even more to talk about. DexCom has announced a partnership with Lifetime, the chain of athletic country clubs, to offer continuous glucose monitors directly to members through its app. You'll recall that DexCom's Stelo biosensor was the first CGM to receive FDA clearance for over-the-counter sales in March 2024, essentially moving from a medical necessity to a wellness tool. Now teaming with Lifetime, the device maker is courting health-conscious consumers beyond its traditional diabetes market. DexCom designed Stelo, a small wearable sensor specifically for people with type 2 diabetes who did not use insulin. It's worn on the back of the arm, and it provides insights directly to a user's smartphone. Stelo features a 15-day wear and offers a software experience tailored specifically for non-insulin users. The company said that it makes it easier for the target population to access this monitoring and offers an option for those who don't have insurance coverage. In addition to availability through Lifetime, DexCom is working on promotions, events, and activations that highlight the critical role that continuous glucose monitoring insights play in achieving overall health goals. The company aims to help more people take care of their health through glucose biosensing technology. That's according to Sean Woolley from Drug Delivery Business Times. When I think about it, this is pretty cool, y'all. I think it's fair to say that gym members tend to be more engaged in their health and wellness, and I'd argue they also tend to be more motivated to avoid seeing a doctor. This type of partnership is what's possible as more consumer devices gain FDA clearance for over-the-counter sales. Now, according to Fit Insider, this rollout advances Lifetime's wellness push. The fitness chain has already added medical services by launching longevity clinics that include hormones and GLP-1s. They've revamped their supplement line to target gut health, anti-aging, and muscle building. And they plan to add cold plunges and beef up other recovery services in dozens of locations this year. In simple words, more of this, please. Because the combo of fitness and digital health truly has the power to make a difference by reducing the need for a healthcare system that is overstrained with no relief in sight. Let's see more preventive services made possible through partnerships that engage consumers in places where they're actively looking to maintain their health and wellness. That's another way that we'll build the healthcare of tomorrow, and that's the Flava of the Week.
The flow.
All right, everyone, let's get into the flow. Super excited about today's conversation. Please join me in welcoming our guest. This week, I'm speaking with Oren Nissim. Oren is the CEO and co-founder of Brook Health. They're a leader in remote patient monitoring, management, and AI-powered health support. Can't wait to dive into this. These are topics that are important for us to learn about. Oren, welcome to the show.
Hey, thanks for having me.
Let's start off helping our listeners get to know you a little bit better. What's something that they might not know about you?
I don't keep it really a secret, but I don't really talk about it much. I've been battling having a complicated version of type 2 diabetes since I was about 30. And so I've been living with that for about 20 years now and have seen multiple doctors throughout my life, have been in multiple health systems throughout my life. And so I guess I'm here to try to solve my own problem. And hopefully I hope some others along the way with the same thing.
Thanks for sharing that. I imagine that just informs your perspective about everything you're doing on a day-to-day basis. Is that true?
We're all just consumers that happen to be living with not such a great condition in the background, and that is something that we now need to retrofit into our life in some way. None of us have selected to do this, so it's the club that you don't want to be a member of. And how do you kind of stay out of trouble, keep it at bay, and live a happy and long life with it?
So true. I love that perspective. I think that will inform our conversation today as well. And we can dive right in because I'm newer to understanding what Brook Health is and what the company's all about. So I would love if you could share maybe a condensed version of the origin story of the company, specifically, what problem are you working to solve? And how is your solution different than others that are on the market?
I mean, I'll take you back basically 7 or 8 years. I've been working on lots of things that had to do with mobile phones and sensors that were becoming more and more and more available to the market. And, we started to notice that, when we are, as consumers, when we are carrying these devices on us, we generate quite a lot of information about what's going on around us on a day-to-day basis. How much are we walking? How much are we sleeping? Have we things like exercise, if we're measuring exercise, but things ultimately that have to do with healthy or unhealthy daily behaviors. And when I was thinking about this, I've been trying to manage my diabetes for a very long period of time. And for me, the aha moment was, the biggest problem for me as a consumer is remembering and keeping it top of mind. Because as I said, it's not something that we like to do. Diabetes is not fun. And by the way, we're not just doing diabetes here. We're doing more. We'll talk about that in a minute. But I think it's true for anyone with an ongoing chronic condition that it needs some maintenance and it needs some ongoing attention. And as consumers, it's just not fun to do. And so, the places that you go into as a habit are, you want to be more in the fun places. And so how do you use technology in order to remind you throughout the day, inform you throughout the day, make sure that you're sort of staying on point, being really, really kind of on your chair the entire day. We're not sure if you even remember to take your medication, but it'd be good to be a little bit more active because, your blood sugars are going to behave in a different way today if you're going to continue to be, so sanitary. So it's just a small example of the fact that as you kind of go throughout your day, not wanting to be thinking about your chronic condition, how does your daily behavior actually could be a little better and keep those things at bay if you're more engaged with it. So that's the origin story. Since then we sort of evolved this idea, if you will, into a complete company whereby we're using AI in order to track all of those signals that comes from all of these different devices, both medical devices, blood pressure cuffs and glucometers and weight scales, all those things. And also from your phone and from your, Fitbit or Apple Watch or whatever the case is, so that we can really get a very cohesive picture of how's your day going and how can we remind, intervene, give you a little bit of a nudge. Sometimes a nudge is also going to have a high five, just saying, hey, you've been doing great today. I mean, that's just as meaningful, if not more meaningful in the end, to make you feel a little bit more successful with it. And kind of by being able to stay present and accountable, we are solving, I think, the biggest problem that nobody really likes to talk about, which is the problem of agency. So in the end, both for the consumer and also for the healthcare provider who is now trying to be involved and help that consumer to, they call us patients, right? So the help the patient, both sides lack agency. On the consumer side, I'm living my day-to-day life, knock on wood for the most part. The big things that happen in my health do not happen in a sudden moment. They happen over a long period of time. So how do I stay in check? It's really got to do with daily healthy or unhealthy behaviors. It could be as simple as, am I taking my medication or not? But that's just a one piece of a question. How am I eating? How am I sleeping? Am I being active? Am I under stress? Am I, other things that really impact my whole health, if you will, and how to stay a little bit on the better side of it is what keep those chronic problems at bay, right? It's what keeps us in control. And when you think about what do I as the consumer need, I need something that's a little bit more available to me on a more consistent basis. Meaning, finding the time to see the provider for the next time is always a hassle. It takes time. We schedule the appointment. We go in. And under the best circumstance, I'm not going to see my provider more than once every 3 to 4 months. And frankly, that's a lot. Most people are going to see their provider basically once a year. And so what happens in the middle for me as a consumer? And how do I get some level of agency with what I do? And from the provider side, it's sort of the same problem. Meaning the provider says, okay, the patient's going to come in. I'm going to give him all this help and assistance and advice. But then they go home. Are they actually going to follow what I said? And for the most part, we know that statistically the answer is absolutely no. They're not going to, us consumers are not going to follow that advice to the letter. And it's not because it was bad advice. It's because we're stressed. We have a daily life. Or, we're busy. We don't think about it. And so it's hard to always remember what was said. And so, we leave the office and we remember probably about 10 to 15% of what was said. So what happens with the other 85? Out of sight, out of mind, up until next time we see that provider, So it's a constant state of I, the consumer, feel I'm not exactly on top of it and I need a little bit more help. And on the provider side, it feels like, well, I've told them everything I could have in this one session. Why don't they do it? So it's a constant state of unhappiness, if you will, or lack of agency on both sides. And I think that technology today has really evolved into the fact that this can be a daily habitual use, really easy to do, all from your smartphone. You don't need to go anywhere. You don't need to schedule the next doctor visit. You don't need any of these things for the ongoing, for the day to day, in order for you to get a little bit more agency. But it's work, so we're going to be working to get consumers to get used to this.
I love that. I love the part especially about the understanding of our daily lives and the daily decisions that are involved in our health and our care. And to me, that's an understanding that I've been gaining as I speak with leaders like yourself about creating and designing services and products that are consumer centered. Because when we put the needs and desires of a consumer at the center of the entire process, we have a very different design process and a very different business model. Honestly, we have very different types of healthcare organizations that are being created as a result. And I think that's a good thing. And that leads to this side of just understanding how an everyday person, a consumer, like you said, we're not a patient every day. We're not even seeing the doctor every day. That's a very realistic perspective. So that's why we distinguish between a consumer and a patient. We're making healthcare, at least health or care decisions on a daily basis, health and wellness decisions on a daily basis. So some of those involve a doctor, sometimes they don't. And for us to realize what is sitting there in between are all these day-to-day choices, like you were saying, that leads me to this thought of, okay, so how does a solution like Brook Health, we can dive in a little bit here in terms of what the solution does to help lead to that result, and maybe even backing up a step beyond that. What was available or what was not available on the market that led you to say, this solution needs to be created? This is what's going to help people with some of those decisions.
I think that what was available, and for the most part, what is still available, is that if I'm a consumer and I'm tracking some health data myself, so blood pressure or glucose or oxygen in the blood or things like that, I can use today devices that are becoming cheaper, way more available. There's no problem getting them. That can give me those numbers. That I can do. What I cannot do without a lot of reading and studying and really, really understanding what the heck's going on is associate those numbers with, what actually caused it? Meaning, what is the analysis of what happened prior to me getting those numbers? Because, when I look at the number, I'm essentially looking at the result of something. So blood sugar spiking higher is a result of things like eating sugary foods. But it's also the result of maybe I'm very tired. Maybe I am in a different climate than I'm used to be. There's all sorts of other things that people don't really appreciate the fact that our body responds to many, many things all at once. And so the direct correlation between just one action and another is not always necessarily there. For me as a consumer to wrap my head around that and really get to the point that I'm really doing data analysis is hard. And so guess what? I don't do it for the most part. So even though the numbers became more available, that in and of itself didn't necessarily change the outcome, the health outcome. So what needed to happen? What needed to happen was the level of analytics and dumbing it down, meaning getting to the point that not only do I not care necessarily about the number itself, I just care about the health behavior and the analytics that then lead to the number. So, one simple example of that is things like getting up in the morning with particular blood sugar behavior has got to do both with sleep quality, with taking the meds at night, frankly, with what they have for dinner before, with all of these different things all at once. And getting to the point that instead of, just looking at a number and the number looking back at me and me not knowing what to do with it, and getting into some assistant telling me, hey, it looks like you haven't really slept great last night. And, we think maybe dinner was too long, or maybe there were a few too many drinks, or whatever the case may be. Here's a great thing you can do this morning. Drink a shake. Get out and do a quick walk before you head to work. Something whereby it's turning into a proactive, immediate action that I can actually take. I mean, a lot of these chronic conditions obviously are very, very long term. And so many people say, well, you do this right, it will resolve things for you 20 years later. Most of us consumers do not do great when we're being told do something today for what's going to happen 20 years from now. We want immediate gratification. So can we dumb it down into something that's going to be, here's immediate gratification. If you do this morning, you're going to be better today. And here's why. That invokes action. That invokes also, frankly, a more proactive listening on the consumer side, because the consumer is like, okay, here is something I can do today, right now, right this second, to have a better result today. And we'll talk again tomorrow. So we built this assistant. We built this assistant that ultimately analyzes all of these figures and comes up with these nudges and advices and things that are not about, oh, let's look at a bad number, but say, hey, given this, how about this?
It sounds like you're talking about breaking down some silos that have traditionally existed, right? If I understand here, between care management and the technologies available to track things remotely. All the monitoring technology that has been available, you're bridging the gap now, or breaking down silos from what I'm hearing here. Why is that important for us to be able to see different results? Like, why do we need to break down those silos?
We humans have been doing this for a very long period of time, meaning we went to providers. Providers told us, hey, here's what I'm seeing, here's my diagnosis, and here's what you're going to do. And the reality is that when they speak to people with chronic conditions, they provide a lot of information about how to live day in, day out. And so they're doing care management, but they're doing it right there and then, right there in that visit. And it's lasting somewhere between 8 and up to 20 minutes or so. And then you go home. And what you really need is you need sort of a best friend who also happens to be good with medicine, so they can give you some ongoing advice. Some relationship whereby you can rely on this a little bit more. It's very accessible to you and you have no problem asking the next question and do it on a consistent basis. So breaking down the silo of, okay, I can get the numbers, I can get the data, to what does this data mean and how now do I do something about it, is the key most important thing. And when you think about the amount of people that have a problem, I mean, that number is it's ginormous, right? I mean, we're talking about 30-40% of the adult population living in the US has something or other. And so how do you get to the point that you can actually provide good feedback to all of them? I mean, not enough hospitals, not enough doctors, not enough nurses, and frankly, a healthcare system which is costing us more and more and more every year. So, clearly the solution is not to manufacture more people who can do these conversations with people. The solution is to augment behavior and move behavior much more to this agent type approach, which is, I can be seeing everything. I can be providing you the daily nudges and the feedback and the support. And frankly, most of this information is completely out there, So it's more about how can I consume this information in a way that weaves into my daily life and I feel I can trust it, as opposed to, is it available.
That explains it all to me, because just because somebody's aware of something doesn't mean they're going to trust it, especially in healthcare. We just, as human beings, don't naturally get there without some help, without some education on the topic, and sometimes even a demonstration of it. So glad you brought that up. That's an important part of this puzzle here, if you will.
Yeah, and I think that one key thing that we have solved for, because I mean, you asked me, so I get the idea, I get the concept, Oren, what do you do in the end of the day? What we do in the end of the day is that we built a system whereby the person prescribing the service to the patient is the provider. And so if we start from the word trust, patient, consumer, do trust their doctor. They do. It's the person who diagnosed them. It's the person who told them what they got. It's the person who told them what they need to do now as they go home. So trust is formed in that particular relationship. So most consumers will tell you, hey, I just need to listen to them more, which is both a reflection of what they need to do, but it's also, frankly, a reflection of something that they haven't done well, which is not associating itself with good behaviors, right? Like, people feel punitive about their own behaviors, and we're trying to get out of that, and we're trying to get into the whole, hey, this provider now, through this assistant technology, is actually available in your pocket 24/7. We're going to be observing, but at the same time, we're available all the time. And when Brook isn't trying to develop its own outside brand. Brook is just trying to be that connecting fabric between that provider that you trust and your daily behaviors at home, by being present, by being accountable, by being something that you can really rely on and trust. But guess what? Whenever it's time to make a new medical decision, Brook is going to go back to the provider and say, hey, here's what we've noticed, here's what's going on, here's where this patient is right now, and etc. We need you to jump in here, because a genuine medical decision is needed. It's not about training you on how to eat better foods, which is not something that you need a doctor for, but it is now something where an intervention is required, but it's all cohesive. It all speaks the same language, and it's all coming from the same source. So we're over-indexing on trust as the mechanism to bridge this gap.
What else would you would you want consumers to understand about these new opportunities that are now available for them to have a solution like what Brook Health provides, but just these ultimate opportunities for remote patient care management to help improve their health? Like, what else would you like consumers to know, I guess, and understand?
For me, in the end of the day, I go back to the word agency, because, I mean, we can talk about technology and we can talk about fancy tools all day long, and, I can do that. But I think most consumers, what they need to understand, your condition does not define you. What you have is absolutely 100% treatable, manageable, and you can live a very long, happy life with the case of hypertension, the case of diabetes, the case of heart problems. These are all things that, you can do this, and there are available tools for you out there. It's not expensive. Most health insurance covers for it these days, which is go seek your provider and ask them to let you have it and let you start using it, because it will change your day.
What a perfect place for us to wrap up, because I think that's the practical message that I loved being able to share with our listeners today about what's out there, what's possible, and the opportunities now that are there for them to have a day-to-day health and wellness journey that is in a different place, a better place for them. So, Oren, I want to thank you for joining us today, giving us so much to think about. Thanks for being on the program with us.
Thanks so much. Great to be here, and lovely to meet you.